Hi everyone, I'm Dr. Parissis. I work in London, UK, in partnership with Dr. Feller and Dr. Bloxham in Great Neck, New York. And the question I want to talk about today is, does Minoxidil and Finasteride stop hair loss for good? I think a lot of people are very familiar with these two medications. They are the only two FDA-approved medications for male pattern baldness. The first one being Minoxidil. In history, Minoxidil was first used as an antihypertensive medication or an anti-high blood pressure medication. So the reason for that is because it dilates the blood vessels and therefore brings the blood pressure down. It's no longer used for blood pressure, commonly at least, and is instead used in a topical formation for hair loss. It's applied topically to the scalp and it does exactly the same thing. It dilates the blood vessels just near the follicular units, near the follicles, and in doing so encourages more blood to go to the follicle, bring along more growth factors and encourage more growth. However, it doesn't get to the root cause of male pattern baldness, which is, according to research, most closely linked to dihydrotestosterone, the more potent form of testosterone that testosterone is converted into. There are receptors at the follicles that are sensitive to dihydrotestosterone, and unfortunately when dihydrotestosterone binds to these receptors, it causes progressive weakening of the follicle, which shortens and eventually falls out. The second medication, Finasteride, or sometimes patients use dutasteride, which is the stronger version. Both of these inhibit the conversion of testosterone to dihydrotestosterone, and that means that there's no there's less dihydrotestosterone to bind to those androgen sites in the follicles and cause that weakening or apoptosis or death of the follicles themselves. So Finasteride has been found to reduce serum or blood DHT levels by up to 70%. We have found that dutasteride has actually decreased serum DHT levels by up to 95%. So some patients have reported that there's better efficacy, that their hair loss has slowed down further with dutasteride over Finasteride. However, it is not yet FDA approved for male pattern baldness. Now, one thing that medications do not change is your genetics. So as I'm sure you're aware, male pattern baldness is genetic, so much so that we can actually predict the severity of someone's male pattern baldness with quite good accuracy. This is a paper by Dr. Chen that I wanted to highlight, and I want you to see here that they're able to predict severe hair loss or severe male pattern baldness with an ACU, which is the area under the curve, which basically correlates to how accurate the prediction model is. We can predict with around 0.725 to 0.728, so around about 72% accuracy, we can predict someone will experience severe male pattern baldness. It's a little bit less with those with less severe male pattern baldness, but that's quite good accuracy. And so it shows that male pattern baldness really is genetic. Again, reminds us that those medications, whilst they might have some effect, cannot actually change the genetics of someone's hair loss. So what I want to outline with respect to genetics in male pattern baldness is that each follicle has a specific sensitivity to androgens. Follicles have different sensitivities based on where they're located on the head, and that follicles with high sensitivity might not be in the same place for one person as they are for another person. So one patient might have very high androgen sensitivity in the follicles in their hairline. Others might have higher androgen sensitivity in the follicles in their crown. And that's going to affect, of course, how male pattern baldness progresses for those two patients. One thing I did want to question is, it's interesting how there's lots of research papers on the efficacy of Finasteride and dutasteride for male pattern baldness, specifically for slowing it down. There's lots of research papers on that, but there aren't any research papers on the possibility of continued hair loss when patients are on these medications. It's interesting because in our practice, and certainly Dr. Bloxham has seen who have been on Finasteride and Minoxidil, some of them on dutasteride, and their hair loss has simply progressed. This again reinforces the idea that these medications slow down hair loss, they don't stop it for good. Because of the lack of papers on this subject, I thought that it would be better than nothing to plummet down the level of evidence pyramid to anecdotal evidence. So I thought I'd discuss some of the anecdotal pieces of information that I was able to find just looking on the internet. So these patients are taken from YouTube comments as well as Reddit posts where patients have been quite concerned that they've been having continued hair loss despite being on these medications. This particular patient is from the UK and he's been on Finasteride for 3 years. He's now started to see continued hair thinning. Initially it seemed to work for him, especially in the first 18 months, but it has started thinning again. And so he's considering starting dutasteride over finasteride because, of course, as we said, there is greater blockage of DHT with dutasteride over finasteride. With this particular patient, he has been on 1 milligram of finasteride for a while. And he said that he has literally gone from a Norwood 3 to diffuse Norwood 5 despite being on finasteride. So he, just like the other patient, considered switching to dutasteride, did switch, and never looked back. He said that that helped. There is a lot of evidence to show that dutasteride does have superior efficacy over finasteride in slowing down hair loss because of that increased blockage. Another patient who's been on finasteride for 14 months, he said that he initially had very good response to finasteride, and this is something we see quite commonly. Patients will start finasteride within the first 6 to 12 months, their hair loss will stop, but unfortunately with the hormonal or endocrine system, the endocrine system is very complicated and there's lots of different routes and pathways. But generally, if there's blockage or a disruption to one pathway, the endocrine system is very good at finding other ways or other pathways of making the same hormones. And so that can happen with finasteride. The body is very good at adapting, and if it wants to produce DHT, it will try its utmost best to do so. So this particular patient, he could feel his bald spot just after 14 months of treatment. He feels his genetics are fighting back, and he's a little bit disappointed as well. So he's going to add minoxidil to his treatment plan. I totally agree with this particular person who said that hair loss is stabilized by finasteride. In his particular situation, he saw stabilization for around about a year, but then he still lost ground, but at a slower pace. And so it's important to have the right expectations. This patient, just like the previous ones, he's been on finasteride for over a year, and he's noticed that his temple areas are receding, and they're continuing to recede. This is supposedly a 27-year-old gentleman who has been on finasteride for 5 years, and he's just started receding, which is very interesting. It's interesting that some patients are responding very well for a year and then noticing more loss after a year. And then other patients can be on it for 5 years and pretty much notice minimal loss, but then can quite rapidly recede. This is just a friendly reminder that male pattern baldness is very, very difficult to predict, even on medications. And that's why strategic planning with your hair transplant surgeon is just so important. What does this mean for hair transplant surgery? Now, we do encourage patients to be on preventative medication, but we do not require it for surgery. There are some hair transplant clinics that do. However, we like to plan ahead and do so as if the patient is not on any medications at all. Because as I said, male pattern baldness is very unpredictable even if they are on medications. And if it's someone with advanced hair loss that comes to us wanting hair transplant surgery, this is even more the case. For example, being under the age of 30 with significant crown loss, or at least a Norwood 5, then it's highly likely that the patient's hair loss is pretty much inevitable. And so preventative medication is just going to delay the inevitable. So for example, with these patients, we might tackle the front half of the scalp with hair transplant surgery to put him in a good position in the future if he does lose more despite being on a medication. So I hope you enjoyed this video. Once again, I'm Dr. Parissis from Parissis Medical. I look forward to seeing you in the next one.